Hello, welcome back to 12 Days of COVID. This is Dr. Lori Carnsu, day number 9, treating COVID at home. Many of you are quarantined right now with COVID. I know the numbers in my area have been climbing this week, and I have friends around the country who are telling me it is that way in their areas too. So the main thing that people want to know when they're home with COVID is, the scary part is, when should you go to the hospital? When is something serious? So there are some red flags that you want to be aware of, and the first one is breathlessness or trouble breathing. Now, most people don't get this, but it is something to watch for. I do recommend, if you have chronic disease or you're over age 50, that you get an oxygen monitor. And these are monitors that you can now buy at the store. That's the little clip that goes on your finger when you go to the hospital or the doctor's office. And the normal number for that is 98 to 100%. So if you're at home, that's something to watch. I recommend checking it twice a day if you're one of the high-risk groups. And if that is over 95%, that is fine. If that starts dipping below 95%, that's not an emergency, but you do want to get a hold of your healthcare provider or your physician and talk to them right away. If it drops below 90%, and especially if you have blueness around your face or nose or fingers, then that can be an emergency, and you really don't want to wait to get a hold of someone. You want to go into the emergency room, especially if that is staying low. So the other thing to watch for is lightheadedness. Now, most people will feel weak and a little tired when they're up and walking, but you shouldn't feel lightheaded as if you're going to pass out. Now, the main thing that you want to do to prevent this is hydration, plenty of fluids. Water is important, but you can use any electrolyte replacements as well. So usually getting up is a sign that you're dehydrated and your blood pressure is dropping, but if you can't take fluids and you can't keep them down and you are getting weak and dizzy when you get up, then that is another reason that you need medical attention. The other thing to watch for is less common, but we do see it with COVID, and that is blood clots. Most people that get blood clots with COVID are people who are sicker already and in the hospital, but it is something to keep in mind. One of the things that is a sign of that is a low oxygen level. So again, keeping a check on your oxygen level. But usually with a blood clot, you would have a clot, say, in one leg, and you might have tenderness just in one calf and swelling in that leg that's different from the normal muscle aches that you may be experiencing. And then if that blood clot goes to your lungs, some people will have a sharper type chest pain. Now, most people with COVID have some kind of chest discomfort when they move around and the muscles are sore. This is usually a sharper chest pain, and it's sudden, and it's associated with shortness of breath. So if you have any of those symptoms, make sure that you talk to someone or you get checked out with those. The remainder of the symptoms, which are very common and most people have, are similar to other cold or viral symptoms. They can include diarrhea, vomiting, stomach aches, cough, congestion, stuffy nose, sore throat, runny nose. And those can be treated the same way you would treat normal cold symptoms. So use your over-the-counter cold medicines, use honey or tea for a cough. Many people want to know about supplements. What can they do as soon as they find out to help their body fight this off? Now, there's elderberry, vitamin C, vitamin D, zinc. These have all been studied and used quite commonly. And just like with many colds in the past, there hasn't been a whole great big body of evidence that prove that these really help any better than the hydration and everything else you do for a cold. But there's also no data that they hurt. So if this is something that you feel that is going to help you get through it, then that's fine. But just be aware that there's not huge amounts of evidence that that's actually going to fight it off. Supplements are one. But what I think is really better for your body, and we do have evidence for, is food. So eat your berries. This is the time to get all the antioxidants and nutrients in. And even if you don't normally eat that way, it doesn't hurt to start even when you have COVID, because very quickly your body will start using those nutrients, and that's going to help beefing up your immune system and your response and your immunity to this, as well as helping your blood vessels fight through this disease. So the best things are berries, any color, any brightly colored foods, and greens. Greens actually help open up your blood vessels a little bit. They act almost like nitrous oxide for the first couple of hours after you eat them. And those could be dark greens like spinach greens and Swiss chard, cruciferous vegetables such as broccoli. So if you have an appetite and you can stomach those, then that's fine to add those to your diet. If you can't, just worry about your fluids. And the last thing I wanted to mention really quick is something called prone positioning, or sleeping on your stomach. This has been going around a lot, and it's been used in the hospitals quite often. Many people that start to feel discomfort or chest heaviness or have this with COVID say that they feel more comfortable sleeping on their stomach. And this is something that they do in the hospital. If you feel more comfortable on your back, then stay on your back. But if you are having discomfort, you may want to try lying in your stomach or lying in a recliner, and that can be helpful, but it's not necessary for most people. So thanks for watching. Stay tuned for tomorrow for part 2 of vaccines. Good night.